Today, HIQA has published a health technology assessment evaluating the options for the treatment and transport of Priority 1 transfer patients. Priority 1 transfer patients, for the most part, are children who require urgent transfer to specialist centres in the UK to avail of liver and heart transplantation. The child must be at the hospital in the UK within 4 hours of notification of a donor heart becoming available and within 6 hours of a liver becoming available. On average, there are 5 Priority 1 transfers each year, with 3/4 of these occurring during the night. Historically, the Air Corps and the Irish Coast Guard have provided Priority 1 transfers. However, due to staff capacity constraints in the Air Corps and regulatory requirements of the Irish Coast Guard, neither service can continue to provide nighttime Priority 1 transfers. The optimal immediate option, which is in place already since the 6th of November, is for a private provider to provide an aircraft plus crew on standby at Dublin Airport to provide Priority 1 transfers if required. The short-term options for implementation within 6 months are to explore if the Irish Coast Guard can move from a 24-hour to a 12-hour roster at one or more bases, thereby enabling them to provide Priority 1 transfers at night. To explore a partnership between the HSE and a registered charity to provide a dedicated air ambulance at a lower cost than the HSE could negotiate on their own. And speculatively to explore whether the Irish Coast Guard could fly Priority 1 transfers under search and rescue rules. Long-term options will likely leverage off existing state resources. For example, the Air Corps could provide an air ambulance service on an as-available basis, or alternatively the HSE could provide an aircraft and the Air Corps provide a dedicated air crew. Another option is to renegotiate the Coast Guard services contract, thereby requiring the Irish Coast Guard to provide a dedicated aircraft plus crew for air ambulance services. Selection of the optimal options for Priority 1 transfer requires consideration of affordability, the impact on other services, and crucially, the provision of safe, effective, patient-centred care.